the two-row, talks about the river of life and how we travel on this river of life together. The two-row is positioned where there's two purple rows, a white row in between the two purple rows. And that signifies that we each have our cultural beliefs, we each have our values, our principles, our understanding of life, that we will travel on the river of life together, respecting each other, and in friendship and in peace.
There are a number of things that we hope to obtain and understand and realize more about these things that are happening in our communities. Cancer-related, but also things that are co-occurring with cancer. What does the journey look like for not only a patient, but a provider from Indian Health Service centers on reservations that are working with rural safety net providers in adjacent rural communities? But also we're looking at our ancestrally related tribes across the river in Canada. The benefit of our project to Indigenous communities, the goal is really to provide quality improvement in programming related to the cancer care continuum. Now, quality improvement is slightly different than research. Quality improvement is a way of providing information from roundtables, from discussions, from interviews, from community interactions, and from this project that we're going to provide that back to the communities in the hopes that they use the information in a useful and beneficial way for their community members.
It's a challenge, and from my position is getting the community as comfortable with us as they can, so they don't hesitate coming in here when they need help. Everybody that walks through the door is in need of something, and that's what we preach here. Many times the providers out there, and we're talking cancer treatment, a lot of times the providers are learning more about us and what we do here. They encourage that contact and will get us to be involved in the treatment process. Because a lot of times the primary and treatment process certainly are parallel tracks. The screening itself, many times, most of the time it's done off-site, and the primary then will determine the best route to do the screenings, which is not close to us. It involves transportation. There is assistance for transportation to these screenings. We do have staff that help out, but compliance is certainly an issue.
I tell people, if anything, I'm just another point of contact. If you're having an issue trying to fit in the time to see a provider here, I can kind of work around that.
Calgary Hospital's goal is to offer traditional services and Western services. Within our community, we have home care nurses, we have support people in home care that can help people who need it in the homes. We have an abundance of, every health professional that you can think possible, from occupational therapy, physiotherapy, dietary. our physicians, our nurses. We have psychologists in the community. We have support people. We have a cancer support group that meets monthly, which I go to the monthly meetings, where anyone in the community who has cancer and or their family and or their friends, our doors are open to whoever wants to come. 3-4 years ago, we had community women sit around a table and decide that we needed to help people on their cancer journey. And it's called Dede Wajak Degenhas, which they translated to We Help Each Other. And it's to offset costs and the burden of financial costs when people undergo a journey. And we want to help people with that.
In my own way, my own understanding, and how we take care of each other here on reserve is taking care of each other from a spiritual perspective. It is giving people hope, taking care of people and treating them with love and care. I used to be a Mohawk language teacher. God, in another life. And the language is beginning to really pick up in our community. Young people are speaking Mohawk again. It carries our morals, our ethics. It represents the way we view creation and the world. That's what the language is.
It equates to medicine. When I say traditional medicine, language is part of that medicine. Our drumming, our ceremonies, our sweat lodges, our circles.
Part of the work we're doing is the discussion we're going to be having today regarding the cancer care continuum for Native American people in the community through the cancer process. Discuss with them and community partners how people are moving through the process, from cancer prevention, treatment, management, survivorship, and palliative care.
Any client or customer enters our doors, whether that's here, in our shelter, through a school district, whatever the case may be, that there is a centralized intake and needs assessment process for everyone. That needs assessment then leads to referrals both internally within the organization as well as to external partners in the community.
We do take our clients to like the Olean County building, and that we can help them get insurance if they don't have insurance. We can help them set up med travel if they don't have access to transportation to their appointments to ensure that they're not going to miss that. Then we've sat with them and helped them set up a primary doctor before. Those are things that we've done. They're not really like in our job description, but we're just kind of here to help.
Thank you. You've all been very inspiring.
Thank you.
Thank you.
Sometimes patients can feel very lost. Sometimes they can really like their oncologist and feel like that's their home for a little while and not whatnot. But I think that's where, they're going to so many different places. It can be, you can kind of lose them in the mix for a little bit. From the screening perspective, that one is more difficult, and probably for every rural community as well as just being from a Native population. It's difficult to get any of our patients to go and get their mammograms, although they're doing, the mammogram bus, which is somewhat mobile. But any of the cancer screening type tests and measurements are somewhat difficult. So that colonoscopy is difficult to get. And I think in the Native community, probably just across the board, there's always been that mistrust of the medical community or outside communities in general. So sometimes getting them to go to an outside provider to get their colonoscopy is hard, whether it be because of financial reasons, transportation issues, just the referral process, or you know, there's a list of them. The community hospital that closed provided ER urgent care. Now that we're kind of losing that urgent care, some of those screenings or things that you would normally maybe not get done at an urgent care, but maybe that you would miss or see at the urgent care, it definitely could affect as far as cancer diagnosis detection, because maybe they're coming in for that chest pain that they have. You know, we did a CT, oh, we found this incidentally. So now people have to travel a little farther. It's a little more difficult again, and they may just not follow up.
We're creating a service delivery system. They're not coming directly to us. We partner with the New York State Health Center, which Tuscarora and Tonawanda have available to them, or they can come here for behavioral health and dental. We temporarily do not have the medical service.
Continuity of care is probably the most important thing. I mean, I think at this service unit, at this level, I mean, you know, we have probably could break it down to 3 contributions. I think we could certainly aid in the navigation process, which is important because it's very confusing. You know, people don't know, you know, what's next or what they should do or what they should do with the information that they're getting. They don't know very often, you know, the path that they should take in the sequence of events, okay? You know, obviously screening and prevention, because we do have access to these patients who are showing up on a daily basis for a whole other different reason.
Many Native nations offer an array of services to support cancer care to both patient and caretaker. The cancer journey would benefit from cancer-specific patient navigators to coordinate across the cancer care continuum. We can increase the number of screenings by continued outreach and education. Indigenous values and spirituality is a protective factor in the prevention, treatment, and survival of cancer. Building sustainable organizational process between Indian Health Services, cancer centers, and community partners is crucial for enhancing the quality of life.
We don't ask for much. We ask to help us through what we're going through. You know, no one usually asks Spirit to do anything more but just to help us with our journey. And I think when we talk about that and teach people that, it's very significant for the good mind to help you, and that ends up giving us the strength to continue on that journey.